My name is Rebecca Wagner. The topic I chose for my sexual health video is TSS, better known as toxic shock syndrome. TSS is a rare, life-threatening complication of certain types of bacterial infections according to the Mayo Clinic. My first encounter with this topic was noticing all of the warning labels on tampon products. Tampon boxes contain a pamphlet informing users of the risks of toxic shock syndrome. But that doesn't necessarily mean everyone is actually reading them. Although TSS is primarily associated with the use of contraceptive sponges, diaphragms, and tampons, it can affect people of all genders and ages, which is why I found it this important to educate everyone on the topic. Symptoms associated with TSS can be similar to that of the flu, including high fever, muscle aches, and vomiting or diarrhea. However, more severe symptoms may include seizures, confusion, sunburn-like rashes, and hypotension. If you experience any of these symptoms, it is important to not take them lightly, as they can rapidly progress and lead to more serious complications, including shock, renal failure, and in some cases, death. Tampon manufacturers have changed the materials associated with TSS in hopes to prevent others from getting the condition. It is important to read the labels included in tampon boxes and to use the lowest absorbency needed, and to not keep them in for any longer than 8 hours as a preventative measure. TSS is not a one-time condition, and it is important to take all precautions to prevent it from occurring in the future. Dr. Raina Hajay, a medical epidemiologist, states that the number of TSS cases has rapidly declined since the 1980s due to the FDA regulating the materials and absorbency of tampons. The FDA required that all tampons include warning labels, despite the decline in case numbers. In 1990, absorbency terms became universal among all tampon brands. Another decline could be potentially attributed to the removal of most of the synthetic ingredients used in the making of tampons. However, tampon companies are not required to list their ingredients, which means that some may still contain the types of rayon known to be associated with TSS. Researchers from Vienna's Department of Clinical Pharmacology have developed a safe as well as effective vaccine against TSS. Although not clinically used yet, it was tested successful in its Phase 1 trial. Phase 2 has been set in place, but will still be many years until the vaccine is implemented into everyday medicine. The research done on TSS and its association with tampons proves that many of the changes made by the FDA significantly decrease the number of cases, but have not eliminated risk entirely.